Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Ever wondered why that weird rash won't go away? It's time to shed some light on the invisible world of common skin infections, a world that's teeming with an astonishing variety of pathogens, each with its own unique way of making our lives a touch more complicated. From the itch that keeps you up at night to the mysterious spot that just appeared, these infections are more than skin deep. Today, we will dive into two specific yet common skin infections: superficial candidosis and Madura foot. Superficial candidosis, an infection that's more common than you think. Let's delve deeper to understand this condition. Superficial candidosis is primarily caused by the Candida fungus, a yeast that is naturally present on the skin and in the mouth, throat, gut, and vagina. Usually it's harmless, but under certain conditions, this fungus can multiply and lead to an infection. What triggers this sudden growth? Factors like a weakened immune system, diabetes, antibiotic usage, and hormonal changes can create an environment conducive for Candida to thrive. Now you may wonder, what signs should I look for? Superficial candidosis often presents with itching, redness, and scaling. These symptoms can be accompanied by a discomforting burning sensation. But where does it strike? Candidosis can affect different parts of the body. Oral thrush, a form of superficial candidosis, targets the mouth, causing creamy white patches on the tongue and inner cheeks. It can also invade skin folds, areas that are warm and moist, leading to a condition known as intertrigo. A quick note: while these symptoms can be bothersome, they're usually not severe. However, if left untreated, the infection can spread and cause more serious complications. So the key is early identification. Recognizing the signs and symptoms of superficial candidosis can lead to an effective treatment plan, curbing the infection in its tracks and preventing further complications. Identifying superficial candidosis early can lead to effective treatment and prevent further complications. Next, we delve into a lesser-known but equally important infection: Madura foot. This mysterious condition is generally a result of a fungal or bacterial infection, often contracted from soil in tropical regions. Now, imagine walking barefoot on a warm, damp soil, as many do in these regions. Unbeknownst to you, the soil is teeming with a cocktail of fungi and bacteria, just waiting for an opportunity to invade an unsuspecting host. A simple cut or abrasion on the foot can provide this perfect entry point. As the infection takes hold, the foot begins to swell, often accompanied by pain. But it's the granular discharge that truly sets Madura foot apart. This discharge, filled with tiny grains or granules, is actually colonies of the infecting organism, a telltale sign of this unusual condition. But why Madura foot, you might ask? The name hails from the hardened appearance of the foot, reminiscent of the weathered rocks found in Madura, a region in India where the condition was first described. However, it's not just the exotic name that makes Madura foot fascinating. It's the fact that this condition, though relatively unknown, can have severe consequences if not diagnosed and treated early. Recognizing Madura foot can be a challenge, but early detection can make a significant difference in treatment outcomes. UMCC, your ultimate medical consultant connectors. Now that we know our enemies, how do we fight them? Diagnosis of superficial candidosis and Madura foot starts with a keen observation of symptoms. Clinicians would typically look for areas of skin discoloration, itching, and discomfort. They may also use skin scrapings or biopsy for microscopic examination and culture tests. However, for Madura foot, radiological examinations might be necessary to determine the extent of the infection. In terms of treatment, superficial candidosis can often be managed with antifungal creams or tablets. For severe cases, oral medication or even intravenous antifungal drugs might be necessary. On the other hand, Madura foot requires a more aggressive approach. Treatment usually involves a combination of surgical removal of infected tissue and prolonged antifungal therapy. Prevention, however, is always better than cure. Maintaining good personal hygiene is key in warding off these infections. Regular hand washing, especially when in contact with infected individuals or objects, is crucial. For Madura foot, protective footwear is highly recommended when walking on soil or in rural areas. Early medical intervention is also vital. At the first sign of symptoms, seek medical advice promptly. Remember, the longer an infection remains untreated, the more difficult it becomes to manage and the higher the risk of complications. It's also important to note that both conditions can recur, so regular follow-ups with a healthcare professional are essential. Armed with knowledge, we can guard ourselves better against these common skin infections.